The next length test that we're going to demonstrate is going to be the Thomas test. And this is going to be a test of 2 joint hip flexors as well as 1 joint hip flexors. The 1 joint hip flexors being the iliopsoas, the 2 joint hip flexors being the sartorius, the TFL, and the rectus fem. As a clinician, you have to discern which muscle is tight. Your positioning, your stabilization, and your communication with the patient is very important to do that. So we're going to demonstrate the Thomas test for you at this time. First thing you want to do as you position your patient so that they can adequately rock back onto the table is to have the table at about the height of their gluteal fold. With that in mind, the tester, the clinician, will stand on the involved side. So if this was Megan's right leg that was involved, as a tester, I would be standing on this side. However, for the purposes of this video, I have to stand to this side so that you can see. My instructions to her will to bring your left leg up to your chest and give it a hug. I'll ask her to hold behind her knee so as to avoid some excessive knee flexion. Then, as a clinician, what I'm going to do is to assist her into the supine position. I'll put my hand at about her C7 level on the posterior aspect, and then I'll come behind the right knee and assist her into a supine position. Okay? So on the count of 3, we're going to lay down. Ready? 1, 2, 3. And I help her to lay down. Now, notice what I've done is I've maintained contact with her right leg. Now, what she should be is in a good neutral spine position. At this point, I want to stabilize her ASIS with her spine in a neutral position. So therefore, what I have to do is to take the thenar and hypothenar eminence of my hand and place it on the anterior superior iliac crest. The reason for that is the 2 joint hip flexors attached to that muscle, to that landmark, and we want to prevent that landmark from moving. Remember the concept of stabilization. So I want to come in here and make contact with her ASIS. The first thing I want to know is, do I have a 1 joint involvement versus a 2 joint involvement? So with the hip stabilized, I will begin to lower the involved extremity. Now, in the case of a normal test, what will happen then is the thigh will come in contact with the table. The knee, you will see, will be normally aligned with flexion greater than 80 degrees, no rotation in the femur laterally or medially, and no abduction in the femur. Going down the kinetic chain, the tibia and its tibial tuberosity will be facing straight ahead in its normal alignment. Next, we'll be using the Thomas test to incriminate or show a tight iliopsoas or a tight 1 joint hip flexor. To do that, we'll go back through the same steps. With her in a neutral spine position, I will stabilize that ASIS. One thing to note is the direction of my stabilization. The stabilization is opposite the pull of the muscle. It is not directly down into the table. It is down and up in an effort to stop the rotation anteriorly of the iliac crest. Okay, so coming in here to make that contact, I'm going to drop her leg and allow it to hang. Now, one of the things that you will note is that the thigh does not come in contact with the table. That tells me that I have tightness going on, because recall that the normal Thomas test, the thigh came in contact with the table. At this point, I must decide, is it a 1 or 2 joint hip flexor muscle? To do that, I will put the 2 joint muscles on slack by extending the knee. It's a passive extension of the knee. In doing this, now I will try to lower the leg to the table. With a tight iliopsoas 1 joint hip flexor, the hip will remain in flexion and the thigh will not touch the table. Next, I'm going to demonstrate the Thomas test that will show you a tight 2 joint hip flexor muscles. Okay? Again, note the stabilization the same way. I'm going to drop the leg, maintaining the stabilization at the ASIS. And again, if you note at this point, you will see that the knee is extended beyond 80 degrees of flexion, and we also have a thigh that is off the table. I must decide where the shortness is coming from. First, I have to investigate the 1 joint muscle. To do so, recall that I extended the knee, and now I try to lower the leg to the table. And if you will note at this time, the femur does lower to the table. This action clears the iliopsoas because I have the 2 joint muscles on slack, and I've lowered the thigh to the table. Now I must return to my resting position, assure my stabilization, and again return the leg down to the position where I saw the shortness. At this point, you'll observe that the thigh doesn't touch the table, and if you look closely at the knee, you'll see that it is extended greater than 80 degrees of flexion. That tells me that my two joint hip flexor muscles are involved. I have hip flexion, I have knee extension greater than 80 degrees. Now, the other two joint hip flexor muscles that I need to begin to consider is the TFL, or the IT band, and the sartorius. In order to interpret that test correctly, you must know what those muscles do. If I have a tight TFL, what I will see as an interpretation for the Thomas test will be hip flexion, hip internal rotation, and hip abduction. At the knee, I may see tibial external rotation. The question for that is why? Those are the actions of the TFL. So consequently, a tight TFL will pull the limb into its action. If I have a tight sartorius, what might I see at the hip? I would see hip flexion, hip abduction, and hip external rotation. Carrying the sartorius on down to its insertion at the pes anserine. If I have a tight sartorius at the knee, I may see internal rotation of the tibia. The third and final hip flexor muscle that I must discern is going to be the rectus femoris. With that in mind, what will I see if I have a tight rectus fem? I would anticipate seeing hip flexion with a decrease in knee flexion. So consequently, I would see hip flexion and knee extension past 80 degrees of knee flexion.